Hi everyone, I'm Kevin, the founder of Osana. I've told you about why we're creating a new model of healthcare in Australia, and I've talked a little bit about how we're going to go about doing that. And in this short video, I'd like to describe what we're going to offer in Osana and why it's compelling for you to give this a try as a patient. So there are going to be 4 differences that distinguish us and make us different from medical centres and doctors that you've seen today. The first is increasing the amount of care that we put into the service that we provide. So ironically, our healthcare system doesn't always care for patients. We don't always spend enough time, build the relationships, and make it easy for patients to access services. So we're going to dedicate a person alongside the GP called a health assistant that's there purely to support the patient in getting the right services, sorting out the paperwork, making sure they get to their appointments and have all the relevant follow-up to keep them healthy and happy. The second is that we're going to really focus on prevention. I've described our health system as being very reactive. We react when patients get sick. It's almost like a breakdown service when the car breaks down. So we like to do regular checkups, focus on when patients are well and how to keep them well over time. We've created a role called a care manager whose sole purpose is to look at all the gaps in a patient's health, do an audit and come up with a health plan that's forward-looking over the next year or two to make sure we do everything possible to keep you healthy and happy. The third is that we want to make healthcare easy, and everyone is busy these days, so we want to be able to provide consults in person, but also over video, by phone, provide a record that you can access anywhere in the health system, and also take you to appointments if you're really unwell, do home visits as well. So think of the example where if you've got a recurrent problem, a recurrent ear infection for example, and we can do a video consult, fax a script to the pharmacist, and all you have to do is go to the pharmacist to pick up that script. That's just one example of making healthcare easy. Another example might be for those that are really unwell and are bound at home, we can come mobilise, do home visits, bring the whole team, and provide a lot of support and services at the home. And the last point is we want to be partnering up with patients to really improve the experience and the education for patients to take charge of their own healthcare. How do we do that? We're going to provide a lot of education, group activities, talks in the clinics every week, and through doing exercise classes, understanding more about the health conditions, we're going to help you improve your health outcome. So by caring more, focusing on prevention, making it much more convenient, and partnering with you with a whole team of allied health that you can access for free as part of the membership, we're going to make it a very different healthcare experience for you at Osana. Thanks for listening.